It's hard to believe, but Thanksgiving is almost here. This seasonal gateway to holiday feasting can bring an unwelcome guest to the table, named GERD. Gastroesophageal reflux disease, otherwise known as GERD, is a digestive disorder that affects the lower ring of muscles between the esophagus and the stomach. Many people suffer from symptoms such as heartburn or nausea, which usually occurs after eating and worsens when lying down. The specialists at Advanced Gastroenterology and Surgery Associates explain GERD and how it is treated.
Gastroesophageal reflux disease. It is a chronic condition. That is when acid in the stomach refluxes up to affect the esophagus.
It actually is a motility disorder. People normally think that it's just acid, but it's just reflux of gastric contents into the esophagus that causes the symptoms. So it really is a motility problem. It's a problem of refluxing. We all have transient relaxation of the muscle at the end of the esophagus, so we all get a little bit of reflux. If we eat a pizza or fried foods, fatty foods, you get a little bit of reflux. But some people get it much more often. People with hiatal hernias, where part of the stomach is slid up into the chest, tend to be more prone to get acid reflux, and they tend to have more significant problems. But it really is a motility disorder. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures, elevating the head of the bed, avoiding lying down postprandially, avoiding some types of food, some medications are vitally important, because we really have no great motility drugs to treat acid reflux.
It has to do how the motility of the esophagus is. So in conditions where the esophagus does not function well to clear the acid when it is refluxed up, that's one. The intra-abdominal pressure is very important as well. For example, eating large amount of food at the same time causes the stomach to distend. So therefore, it causes acid to reflux up. It also has to do with the anatomy. So for example, if at the end of the esophagus is the lower esophageal sphincter, if that for one reason or another is quote-unquote loose, then acid can reflux a lot easier.
Cough is one of the extraesophageal manifestations of acid reflux. So people can reflux gastric contents all the way up the esophagus, can present with hoarseness. As a matter of fact, most of those patients actually are seen initially by an ENT physician, and they would subsequently refer to a gastroenterologist when they do a laryngoscopy and see a lot of erythema of the vocal cords. It's usually from acid reflux. It can present with asthma because of bronchospasm. I think it's mostly lifestyle. Like everything else, there probably could be some genetic components, but it's so common. We all reflux to a certain extent. I think lifestyle sort of exacerbates it.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the GERD Relief Story link icon on our homepage, yourhometownhealth.com.